go over some of the different erythemas. The first two is Erythema marginatum versus Erythema migrans. And so straight off the bat, what we see is for Erythema marginatum and migrans, they're both annular types, meaning that they appear like a ring on the skin. But they're associated with different diseases. Erythema marginatum is associated with rheumatic fever. And we know what causes rheumatic fever, group A strep. And it will present as this evanescent rash. And I like that word because it means that the rash appears and disappears quickly and leaves no trace. So it's this evanescent rash with a ring margin. And that's part of the Jones criteria for rheumatic fever, right? You know the rest of the Jones criteria, which is J for joint or that migratory polyarthritis. We have the carditis or involvement of the heart, nodules in the skin, erythema marginatum obviously, and Sydenham chorea, which are those involuntary irregular movements of the limb and face. Now, erythema migrans is associated, instead of with rheumatic fever, it's associated with Lyme disease, which is that tick-borne disease, right? And it causes neurological complications. And instead of being this evanescent rash, it's a large rash with a bull's eye appearance. So it's a rash with a bull's eye appearance. Okay, they're both annular, but they're different types of annular. Okay, so that is marginatum and migrans. The next two rashes that we want to cover are erythema nodosum and erythema induratum. So for these two, let's start with nodosum. They're both actually paniculatides, right? So this is a paniculitis, and the same is true for erythema induratum, so we can duplicate that, right? They're both paniculatides, but erythema nodosum is associated, and before I go for it, but paniculitis is an inflammatory disorder of the subcutaneous fat layer. And why do we care about that? Well, most skin disorders involve the epidermis and to a lesser extent the dermis, but this is a completely different, deeper layer altogether, the subcutaneous fat. That's what makes it a paniculitis. And so with erythema nodosum, it's associated with so many different diseases, but we can think of our fungi. So we have, first of all, before we think of our fungi, we can think of sarcoidosis. It's also associated, now we can think of our fungi with coccidiomycosis. And it's also associated with histoplasmosis. It's even associated with some streptococcal infections. It's also associated with leprosy and Crohn's and ulcerative colitis. So long list for erythema nodosum. And then if we compare that long list to erythema induratum, you'll see it's very highly specific to just tuberculosis. So that's you can see, this long list for erythema nodosum, and then erythema induratum is just tuberculosis. For erythema nodosum, you'll see, for its clinical presentation, you'll see these painful, raised, inflammatory lesions, specifically on the anterior shins. They like to appear there. And an important clinical pearl here is that you'll see it accompanied by other signs of infection, such as fever, malaise, and even arthralgias. Right? And that makes sense, given that so many different of these fungal and bacterial and systemic and autoimmune conditions can cause erythema nodosum. Now, for erythema induratum, we will see it present as these more persistent, they don't go away, nodules, could also be plaques, that they ulcerate, and then importantly, they heal with depressed scars. Hence the name induratum, because it's an induration of the skin. So you won't, to recap, erythema induratum is, you'll see it ulcerate, heal, and become a depressed scar. You will not, importantly, you will not see that in erythema nodosum. You won't see that ulceration and following steps in erythema nodosum. Instead, you'll see these, they're very painful, right, tender, and they are red and raised, and they're on the anterior shins. You'll see these other symptoms with erythema nodosum of infection, right, which you won't see in erythema induratum as much. It's very specific to tuberculosis. It's more kind of chronic in onset. And so one important thing to point out is erythema induratum is a vasculitis, a nodular vasculitis. So that means inflammation of the small and medium vessels, right, in the affected areas. You'll also see granulomas, and that makes sense because it is associated with tuberculosis. Okay, so you will not see that in erythema nodosum. There is no vasculitis or granulomas. Okay, so now that we've covered the two types of paniculitis, let's go and cover the next two. So the next two that I want to cover are erythema multiforme versus erythema infectiosum. Erythema infectiosum, also known as fifth disease. Okay, so we'll extend this down. So for erythema multiforme, this one is a type 4 hypersensitivity reaction, so that's important to know, right? Type 4 hypersensitivity reaction. Okay, and so that means it's delayed and cell-mediated, right? And for Erythema infectiosum, it's a viral xanthum. So here's a viral xanthum, which basically is a fancy way of saying it's a rash associated with some viral infection. In this case, the virus is parvovirus B19. And so with Erythema multiforme, on the other hand, it's associated with other pathogens, such as Mycoplasma pneumonia. It's also associated with herpes simplex virus. It can be associated with some drugs, including sulfa drugs, right, like trimethoprim sulfate, and also known as Bactrim, and also beta-lactams. Okay, okie dokie. So there's some bacteria that can cause it, viruses that can cause it, and some drugs that can cause Erythema multiforme. So let's keep going down the line. How does Erythema multiforme present clinically? So as is in the name, multiforme, there are multiple types of lesions. So it will present with multiple lesion types. So that includes macules, we can go down the list, papules, vesicles, but specifically it also has these target or targetoid lesions. And these target lesions are interesting because you will specifically see these target lesions in something related to sulfa drugs. Specifically, you'll see it in Stevens-Johnson syndrome, right? So look out for those target lesions in Stevens-Johnson syndrome, which is, again, a type 4 hypersensitivity reaction to certain drugs, and it's a medical emergency. Now, with parvovirus B19, what you really want to look for, with Erythema infectiosum, or fifth disease, what you really want to look for is the slapped cheek rash on the face of typically a child. It's more common in children. And so these are the different types of erythemas to review. We started with Erythema marginatum versus Erythema migrans, the two types of annular erythemas, what causes them, how they appear. We then moved on to Erythema nodosum and induratum, the two types of paniculatides. And then we covered Erythema multiforme and Erythema infectiosum, also known as fifth disease, what causes them and how they appear. And just to show you guys, here is a table that summarizes all the information I just presented on each of the types of erythemas, and also here are some pictures to accompany each one. I tried to pick out the ones that are most representative. Thank you.